Good afternoon, and it is a pleasure for me to be here this afternoon to join the Ministry of Health and national as well as global partners in addressing mental health among adolescents and young people in Belize. Mental health problems constitute a major burden of disease for adolescents globally. An estimated 1 in 5 adolescents will experience a mental health problem within the second decade of life. Self-harm is the third leading cause of death for adolescents, and depression is among the leading causes of disability among young people. However, it is unfortunate that the majority of these young people and adolescents do not necessarily receive the care they deserve, as mental health has been an issue of taboo to be spoken about in the open for many, many years. COVID-19 has presented an opportunity for us to put this on the table at the national, regional, and global level, that together we can discuss and address mental health, especially amongst young people. Population data on mental health conditions among adolescents can help identify adolescents' needs and populations at greatest risk, and help inform targeted and proper interventions to address mental health, especially among adolescents and young people. Adolescents with mental health conditions are particularly vulnerable to social exclusion, to discrimination and stigma, and they even don't willingly necessarily seek help because of the stigma that is attached to it. Educational difficulties, risk-taking behaviors, physical ill health, and human rights violations are a series of vulnerabilities that such young people are exposed to. Emotional disorders commonly emerge during adolescence, and many of the elderly and older people who have experienced mental health in their latter years started as young as 14. Making the difference at this point will be crucial to the future growth and development of this country. Unfortunately, in Belize, mental health is a growing cause of illness in adolescents, particularly among the older adolescents. According to a systematic analysis published quite recently, as recent as 2019, despite a decline in global suicide rate, a few countries, including Belize, have experienced an increase in suicide rate and self-harm over the period 1990 to 2016. Further data from the Ministry of Health Information System also shows that mental health is a growing cause of morbidity and mortality among adolescents. Across the entire population in Belize, older adolescents are the age group with the highest rate of suicidal attempt, even as far up as 2018. The Belize Ministry of Health, together with UNICEF and PAHO, are addressing adolescents' health and the prevention of suicide through national programs and efforts, including building human resource capacity, establishing partnerships with other players at community, household, and subnational level, developing a comprehensive adolescents' health plan, and presenting mental health as a key policy priority in the national agenda. Today, UNICEF is pleased to be developing the measurement of mental health for adolescents at population level, which is a tool that provides real-time information on the experiences of young people with regards to mental health. It can be used as a tool for self-assessment. It can be used for peer-to-peer support. And it can be used even by counselors and social workers so that we can help young people to identify these behaviors and look at how can we help them to address it themselves, recognize it themselves, address it themselves, and pave the way forward. This has been an amazing year effort. It started in 2019, and it was co-created with young people. We discussed it with young people at community level. We discussed with young people at household level. We brought in parents into this conversation. So what you see here today is not just a one-off initiative. It has been a process, and it is the beginning. It is a catalyst for something that we know will mushroom and grow and be able to help our young people going forward, especially within the context of COVID. By informing and engaging with young people, we will be able to provide targeted information, targeted programming to address mental health in Belize. Today, I encourage all of us, parents, teachers, social workers, to join the conversation. You're going to be hearing from young people themselves. You're going to be hearing how mental health has been affecting them, how their behaviors, how the situation, especially with COVID-19, has impacted on them. And together, we can craft what could be the best ways that we can help young people going forward. Please stay tuned, listen to them, hear them, and we encourage you, make your comments online, and we are here to listen so that together we can make a difference for every boy and every girl in Belize. I thank you.